This youth leader, whose face has been blurred to prevent stigma, is one of those living positively with HIV in Mbale. She and her colleagues say they are facing serious challenges in accessing medical services in their treatment for HIV.
Services you could go to the facility or just what they couldn't support us enough.
The dispute arose over the sanctions imposed on the USAID, which was administering the global health aid programs on behalf of the US government. USAID was the driving force behind the AIDS prevention program in Uganda, assisting people living with HIV in accessing ARVs, care and treatment. Services affected by Trump's order include the closure of isolated AIDS clinics, between 80 and 90% of agency staff losing their jobs, disrupted ARV and condom distribution, as well as delivery of preventive and antiretroviral drugs to the disabled, especially disabled suspensions and other services. This prompted legislators on the Youth Monitoring Committee, as well as youth health service providers from Sexual Reproductive Health and Rights, or SRHR Alliance Uganda, to visit Mbale. They found that after the USAID ban, many HIV and AIDS programs were paralyzed.
Many IPs implementing partners are pulling out, and when they pull out, the people they have been working with lack support, and they can't go and reach out to their clients.
They found that many young people living with HIV, especially those with disabilities, are the most affected, with some already dropping out of school and others no longer having access to hospitals for treatment because the community distribution program has already been suspended.
Because some of them, they have even dropped out. The health facilities are trying to look for them, they cannot get them. And they do not have the resources to look for these young people to ensure that they come back and pick their drugs.
Many poor people will find it hard to cycle, to go where health centers are to pick medicines.
They find it very difficult to reach there. So that's a great challenge that has affected young people, which leading to other challenges like low viral load suppression.
Funding HIV services was left to the implementing partners, and these basically were being funded by the USAID program. So government needs to get back to the drawing board and reallocate funds to the HIV program.
As part of the domestic funding, we must increase our appropriation to the Ministry of Health and the Uganda AIDS Commission to enable them, fill the gap.